Scan maxillary and the mandibular Easdent impressions 360 degree. When scanning an Easdent impression, select reference denture or duplicate or copy denture as the scan type. If you use denture adhesive, remove it completely before scanning. If your scanner has AI mode, turn it off. I am demonstrating a scanning strategy. It may differ from your scanner's recommendation, but it has worked the best for me, especially with older scanners that do not capture impressions or dentures reliably. This approach reduces the chance of scan images failing to stitch together correctly, particularly along the borders. Hold the maxillary and mandibular Easdent impressions in your hand and scan each impression. Move the scanner slowly and steadily. Start from the occlusal surface and slowly roll to the border and tissue surface and move to the occlusal surface again and then to the border and tissue surface. Repeat this until all the borders are covered and then finish scanning the tissue surface. Following this scanning sequence, reduce the chance of images not stitching together correctly. The border and tissue surface are the most important. Focus on getting a clear scan there. If there are undercuts that make certain areas difficult to scan, spray a little bit intraoral scanning spray. A light coating will make it much easier to capture the scan. Gently touch the impression and rock the scanner to catch this surface. If severe undercut really makes it hard time to scan the area, you have to add an intraoral scan of the arch. The hole for the undercut area can be filled by merging the impression scan with the intraoral scan. Sometimes, after finishing scanning other areas and returning to the border, you may notice missing data due to software misalignment during stitching. If this occurs, rescan back and forth until all the scans are stitched together correctly. It is important to capture accurate borders from the Easdent impressions, as the intraoral scan cannot capture the border precisely due to the movement of soft tissue at the borders. Therefore, the border of the digital model must come from the Easdent impression. When you finish scanning, turn color off to evaluate. Make sure all the intaglio and border areas have good scan. The occlusal and buccal areas of the Easdent impression help with tooth positioning and bite relationships. Small holes are not critical there. The lingual or palatal surface are the least important. Small to medium-sized holes in those areas are acceptable.